Hello everyone, I am Milica and I will provide a detailed analysis and conclusion on the influenza season in the United States. Over the past few years, the United States has witnessed a significant rise in the influenza cases with a high prevalence of the flu virus in almost all states, where more people than usual suffer from flu. Some individuals, particularly those in vulnerable population, may experience severe complications that require hospitalization or medical attention. This can lead to unprepared hospitals, increased patient numbers, workflow disruption, and staffing issues. Medical staffing agencies provide temporary healthcare workers to treat influenza patients. To ensure that we distribute medical staffing effectively, let's start by addressing these questions. When it's influenza season, who is the vulnerable population? Where to send staff? Observing demographics by month, we can see the influenza season increases activity starting at October and it lasts up to May in most of the United States, reaching the peak from December lasts until March, when we have the highest mortality rates based on our bar chart. Looking closer at the data by region, we can see that the South has the highest numbers of flu-related deaths. This finding indicates the South may need more resources to combat the high flu mortality rates. It's important to note that higher number of fatalities in the South is due to the region's larger population. The next question we need to address is who is the vulnerable population? Observing the chart provides a clear conclusion. Comparing influenza mortality rates from 2009 to 2017 for the individuals over 65 years old are significantly more affected than younger age groups. When grouped into two age categories, over 65 and under 65, the data shows that those over 65 are 181% more susceptible to infections than those under 65. For the purpose of this project, we'll be focused on the population over 65 years old. And now we would like to know where to send staff. Based on a map observation, it can be concluded that there are 12 states with a higher number of vulnerable population affected by influenza. These states have the highest percentages of adults over 65 considered vulnerable. Therefore, it's imperative to provide additional staff in these states to address the increased demand for the medical attention. On the right side, we can see the list of the most affected states. California, New York, and Texas are states with a high need of additional medical staff. Pennsylvania, Florida, Illinois, Ohio, Michigan, Tennessee, Massachusetts, Georgia, and South Carolina are in a medium needs of additional staff. On the bottom, we observe the future influenza trends for the same 12 states above. According to our prediction, the mortality rate of influenza in 2018 is projected to be similar to the rates recorded in 2017. The next year, upcoming year will likely follow the same pattern as those observed in the previous years. Conclusion and recommendation. Influenza season differs from state to state with consistently higher mortality rates in the southern regions. The influenza season experiences at a peak period from December to March. Vulnerable individuals over the age of 65 are at higher risk of experiencing influenza infections due to their health condition. Trends for this age went up in 2017 and will remain same for 2018. Some deaths may be recorded as a pneumonia or other respiratory conditions without specific the underlying flu infections. Recommendation. Vaccination campaign should emphasize the importance of vaccinating vulnerable individuals for both preventing and reduction of influenza mortality rates. Public education, educate the public about influenza symptoms and preventive measures. Also provide a guidance on good hygiene practice to reduce the spread of the virus. Hospital preparedness. Hospitals and the healthcare facilities prepare for the increased influenza activity during the peak seasons. This involves ensuring sufficient staffing, medical supplies, and equipment to handle the potential surge in flu-related cases. To distribute additional staff based on the number of the vulnerable population in certain states, we can do this by identifying the 12 states that have reported higher flu-related deaths, which indicates a higher incidence of the flu among population in those locations. These states have the highest percentages of adults over 65 who are considered vulnerable, and those list of the states you can find below. Thank you.